This presentation is going to go over the dental social history skill assessment. The dental and social history is a continuation of the interviewing process that we do with our patient. After the medical history has been completed, you're going to continue this questioning and interviewing with your patient by asking them what their chief concern is. What brings them into the clinic? Are they having any dental issues? Are they having a toothache? Do they have a broken tooth? Are they having any sensitivity? Depending on how your patient responds, ask follow-up questions. Ask them to the point to the tooth that's bothering them. Ask them the location. Ask them how long it's been going on for. Gather more information. You want to be able to get enough information to be able to explain all of this to your doctor. You will also perform CAMBRA. This will be in your flip chart, and this is going to determine the patient's caries risk, whether they're low, moderate, or high. Then you will perform the periodontal risk assessment. This is the grading and staging process of your patient. You will do this through your radiographs and through your clinical assessment. You are going to want to obtain additional information of the patient's dental history. You're going to want to know what their last dental visit is. What was the full date? Where were they seen? What was completed? The last dental visit isn't when the patient saw their dentist last. It's where they have been seen just in general. Were they here at Herzing University? Were they at an ortho office? Did they have a tooth taken out? The last dental exam, this is where we're going to want to know what the full date is and the location. Remember, if the patient has not been seen by their dentist within 3 years, the patient will need to obtain a comprehensive exam from their dentist before they can return to HU. We're going to want to know what the last full mouth set of x-rays is. We want to know the full date and the location. That way we know if we're going to be taking x-rays here or if we need to get them transferred in. That goes for the same thing for bite wings and the pano. Then we want to ask the patient if they've had any past dental treatment, such as ortho. Has the patient had a history of scaling and replaning? Did they have an extraction? This gives us a better idea of what the patient has been through. And then we always want to ask the patient, how do you feel about coming to the dentist? This question is important because we know that a lot of patients do suffer from dental anxiety. By understanding this question is going to be able to give us the opportunity to understand how we can help create an environment for the patient that is calm, comfortable, and safe. We also want to ask about their social history. What are their habits? If the patient states that they are a tobacco user, we want to follow up with the 5 A's. Ask, advise, assess, assist, and arrange. Ask them about their snacking habits, the frequency, soda, juice. Do they bite their nails? Are they clenching or grinding their teeth? Do they wear a night guard? Continue to ask your patient if there's any popping or clicking or pain while opening their jaw. Your patients are going to be sitting in the chair and their mouth is going to be open for quite a while. So having an idea if they're having any pain in their jaw is going to be able to give us a better understanding. Do we need to give this patient more breaks? Do we offer them a bite guard? We also want to have a better understanding of their personal oral care. Personal oral care is also known as POH. We ask every patient at every appointment, how do you care for your mouth each day? What we're looking for is their brushing habits, their flossing habits. Are they doing anything that's adjunct? So questions to ask is, are you using a manual or an electric toothbrush? If they're using an electric, is it an Oral-B or a Sonicare? With flossing, are they using string floss or are they using floss picks? Do they use soft picks? Do they use anything to get in between their teeth? Do they use mouthwash, and which kind? Do they use a water flosser? And if so, which brand? What kind of toothpaste are they using? Are they using a whitening toothpaste or tartar control toothpaste? And we want to ask the patients what if they have any concerns regarding their teeth. This kind of opens up the conversation of if they don't like the color of their teeth, we can open up the conversation of whitening. Maybe they don't like the rotations of certain teeth, and we can open up that conversation with orthodontia. It just creates an environment of asking these open-ended questions to really start to know your patient. The good news is you don't have to memorize that. On your desktop, you will have a PDF file that has your SoapNote template. We can open up that in a Word document, and it's going to show exactly what it looks like here. And it's going to walk you through everything that you need to ask your patient. So right there you can see CC. You're going to document if there's a problem, and if so, what the symptoms are, tooth numbers, location, duration, and problem. The last dental visit, it shows right there the full date and reason and location. Same with the exam. You can see it's for x-rays as well, for habits, for your POH. So you can use this template to walk you through asking your patient these questions. As you ask your patient these questions, you're going to delete everything that is in parentheses, and you're going to type in what the patient states to you.